Before I even heard of Virta, we had decided as a company that we were going to have two areas of focus going forward. One was behavioral health, the other was metabolic disease. And then I came across the published literature specifically on Virta Health, and that's what really got my attention. Here was a program that had retained more than 80% of participants over a year's time. Here was a program that, for more than half of them, had gotten them off all diabetes-specific medication, and at the same time lowered the marker of diabetes that we all follow, called hemoglobin A1C, to below the diagnostic threshold. If you saw this person's labs, you would not know they were diabetic. That to me was phenomenal. That really got my attention. And that's when I started taking it really seriously. When we saw the results, the peer-reviewed, published results, it was no contest. I mean, they are a quantum leap above everyone else in terms of the outcomes that they're getting and the sustainability over now 5 years into this. The outcomes with Virta are truly a cut above everything else we've seen. One story comes to mind because this was a gentleman that worked for one of the municipalities near us, and he kept calling and insisting that he wanted to speak to the leaders of Banner Aetna. And what he wanted to do was talk about how it had transformed his life. This was an older dad who had a young daughter that he really wanted to play with her, and they do BMX, and he wasn't able to do that anymore. And after a short time on Virta, his life was transformed, and he wanted to tell us about that. And I thought that, wow, how many programs have I implemented over the years where I've got patients begging me to tell me how great it is. I can count one at this point, and that's it. When we talk about the economic impact of diabetes and metabolic disease, it may be responsible for as much as half of all of the chronic disease spend in the United States. But think about the impact on the individual patient. Diabetes medications have gotten out of range for most. If you don't have insurance, it's impossible. So you think about the $500 that somebody may save every year or every month. This becomes very real for patients who are trying to live their lives and deal with this diagnosis. What I believe makes Virta effective. Seeing the data is one thing, but experiencing it was quite another. Diabetes leads to a host of other problems in the body. Well, what happens in reverse is also true. When you take away the diabetes, you start to see improvements in other organ systems throughout the body. NAFLD in the liver gets better. Inflammation in the body generally gets better. Sleep improves. All this has been studied. It just is phenomenal, the impact on an individual's life that a program like this can have. Holistic medicine or whole person health is a buzzword these days, but very few, if any, of the other companies out there have delivered on that promise. And I think what Virta is doing actually does deliver on that promise. You look at the broad impact that this single strategy can have on a person's health, and I don't know how you get any closer to holistic than that. Virta doesn't stop at diabetes reversal. They can offer programs now that are further upstream. In other words, catch it before it gets to that point. So they offer programs for the reversal of pre-diabetes and for obesity. So this really is a comprehensive approach that addresses half of the population who has one of those four problems: metabolic syndrome, obesity, pre-diabetes, or diabetes. That's phenomenal.